Welcome to Nursing School Explained. Today I wanted to go over this drug guide for nurses by F.A. Davis. It's always called the Davis's Drug Guide for Nurses. I particularly like this book because it's very easy to read. When you see drug books, they are very complicated. There's always lots and lots of information. This book is just really easy to look up. So let's look up nitroglycerin here. It's a pretty common medication. So right away, it'll tell you what therapeutic classification it has. So in this case, it's an anti-anginal. Pharmacologic, it's a nitrate. Indication, so when do we use it? For acute uses, translingual, sublingual ointment, and long-term prophylactic, oral and transdermal. Management of angina pectoris. PO is an adjunct treatment of heart failure. IV, adjunct treatment of acute MI. So this is a pretty intense drug that's going to affect the patient's heart. And the production of controlled hypotension during surgical procedures and treatment of heart failures is what it does. And then action. So it increases the coronary blood flow by dilating coronary arteries and improving collateral flow to ischemic regions. And then right away, if you think about arteries dilating, you should think about blood pressure dropping. So then it says here, therapeutic effect, relief of prevention of anginal attacks, increased cardiac output, reduction of blood pressure. Then it goes over how this is processed. It gives it a different routes, onset, peak, and duration, which are very important to know. Contraindications, and then again, OB, lactation, and pediatrics is always going to be in red. And then adverse reactions. Most medications have a long list of medications, but what this Davis Drug Guide does, it gives you everything that's of importance, either bold, underlined, or in red. So in this case, the most common side effects are dizziness, headache, hypotension, and tachycardia. Yeah, there are other ones, but the underlined ones are the most important ones. And then whenever there is something in red, pay attention to that. So for interactions here, we have concurrent use of any of these ED, erectile dysfunction drugs, may result in severe hypotension. Do not use within 24 hours of isosorbate dinitrate or mononitrate. And so basically, any of these might result in severe hypotension because these medications already cause hypotension. Now we're going to give them that nitrate on top of it, so we know we have to very carefully monitor the patient's blood pressure. Now it tells us the different dosages and routes of administration, and then nursing implications. So we want to assess their pain because most likely it's because of angina and or MI. We might look at lab test considerations and then implementation. So things to watch out for. And then for IV administration, it gives you the concentration, the rate that it's infusing, but we already have that over here. And always look at the max dose too. And then it tells you at the Y side compatibility, what you can hook it up to. It continues on here because this medication comes in many different routes. So there is a lot of different things to consider. But the most important part here, always look at the action and the adverse side effects and then the pharmacologic classification right away. And you have a pretty good idea of what this medication does and how to use it and safely administer it to the patient. Again, this Davis Drug Guide for Nurses, this is the 16th edition. They might have come up with a new one already. I think this is 2020 or 2021, but also be aware that all these resources are available in an ebook version, so you can get that. And with my code PETRA20, you get 20% off any F.A. Davis products. So go ahead and check out their products. They have great resources for nurses and nursing students. Thanks for watching this review. See you soon.